Hello everyone, and welcome to this audio podcast. Audio podcast interlude. This audio podcast interlude. This Newspart interlude. This audio podcast is part of a Ztorm and Squala. This audio podcast as part of a Ztorm Logistics production. In this audio podcast, looking at sort of an excerpt as part of and from some peer reviewed and published works. So it's been over 2 decades since the UK government had published a document regarding expert patient, a new approach to chronic disease management for the 21st century. The intention was that healthcare service users would lead others by example and being experts in disease management. Although the initiative was published in the United Kingdom, in Australia, investigators have identified where expert patients in where CKD recognized areas of development or recognized areas where progress was and had been required relating to healthcare provision or healthcare service provision. And there was an issue in around healthcare service provision of appropriate and culturally aware information, and knowing which healthcare professionals and healthcare service providers to approach in aspects of navigating healthcare. And this was especially important in amongst communities with limited access to healthcare, with access with limited access to healthcare, according to sort of published works in around 2018. At the same time, CKD patients, those with chronic kidney disease, for example, with chronic kidney disease, for example, if healthcare service users had receive or identify appropriate healthcare service provision. This had or evidence had informed that that quality of life allows had the quality of life amongst healthcare service users would would improve. And healthcare service users sought to seek out healthcare service provision through, for example, online and social media platforms, which have become some of the most promising aspects of online spaces, and where the healthcare through social media platforms through social media platforms increases also increases the understanding understanding healthcare themes, healthcare topics and themes through lived experiences, thus also prompting sort of thus also prompting and encouraging empowerment and encouraging empowerment and reducing the healthcare disparities. E-health e-health also where e-health is concerned where e-health is concerned, e-health has met some of the challenges such as bridging 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 healthcare service provision for bridging provision and navigating healthcare services which historically amongst healthcare service users in line to varying healthcare conditions, for example, can and have prompted hindrances and barriers. The increased awareness and use of e-health services are also associated with high levels of literacy healthcare literacy and also allowing allowing opportunities for informed decision making in around healthcare services and healthcare service provision. So at the same time, patient healthcare service users who sought to gain understanding in around aspects of disease, well-being, and sort of side effects of particular pharmacotherapy, and the uh, uh, this healthcare service provision can healthcare service provision healthcare service provision can allow prompt healthcare service users and healthcare providers to see efforts in more joined up services where between healthcare sectors, for example, have there have been there have been there have been there have been evidence in amongst the literature where healthcare professionals in between healthcare sectors have tended to work in silos. That draws this audio podcast to a close. This audio podcast as part of Newspart Interlude. This audio podcast as part of a Ztorm and Squala, and this audio podcast as part of a Ztorm Robotics production.